All right, so I want to quickly go through some of the exercises, not so much exercises, but we want to go look at some of the fundamentals of human movement. And when you're analyzing exercise, when you think about the number of exercises out there in the thousands, hundreds of thousands, millions, I don't know, a plethora, like a boatload. It can become overwhelming thinking that you have to analyze and be responsible for all the human movement aspects. So when you're thinking about all the muscles of the body, all the joints, all the movements, and all the exercises, it's like this insurmountable task. But similar to what we did in that assignment, where once you understand the focus and you kind of have a pattern of organization, the data or the information becomes a lot easier to digest. So just to clarify, although the human body is complex and it's amazing, there's only 7 joints, right? And really 5, because one of the joints we kind of look at as a collective. But you're looking at the shoulder, the elbow, the wrist, the hand collectively. You're looking at the spine. You're looking at the hip, the knee, and the ankle. So you've just reduced the complexity of the body down to a 5 to 7 segment thing. When you look at exercises can be really reduced down to 3 basic aspects. You're either pushing things away from you, and you're either doing that horizontally or vertically. Oppositely to that, you are pulling things towards you, again, horizontally or vertically. And then for lower body, lower extremity, you're basically doing, when you're going from a standing position to a sitting position, and sitting position to a standing position. So basically a squat. Now there's different derivatives of that, right? So like the squat can be a single leg, double leg. You can minimize or maximize joint or hip, knee or hip interaction. You can do a lunge, a leg press. But the same basic premise, the analysis, the joint action, the muscle participation, is all the same, right? It varies biomechanically and varies neurologically. But in terms of like gross assessment, it makes it easy. So when you start to approach this analysis or this exercise assessment, the biomechanical, physiological, whatever you're doing, instead of thinking from the bottom that there's so many, a variety of exercises that are there, a single analysis from the fundamental movement covers the scope of all of those exercises. So what I've created is a little document, and it basically breaks the body into like 6, maybe 7 things that you'll normally be exposed to. Like I said, the vertical and the horizontal pushing and pulling. So all of your bench press, and it doesn't matter if you're incline, flat, decline, dumbbell, barbell, close grip, wide grip. It's basically going to be the same, similar. Same thing with your pulling, vertical or horizontal, so your lat pull down or chin up pull up, or a seated row or one arm cable row or T-bar row, whatever frickin' exercise you come up with, it's some kind of pulling the weight towards you. And then when you look at lower extremity, if you can analyze the squat and you do it well, you got every lower body exercise, whether it's a step up, a lunge, a leg press, anything, right? So those are your 5 so far, right? Vertical and horizontal pulling, so there's 4 there, and then squatting, which is number 5. Hip hinging, right? So hip flexion with the pelvis and torso moving relative to the femur. That's a big movement, really important movement for almost everything that we do. And then you have your core work, which we'll talk about core in terms of the ridiculousness of how much focus it gets. But looking at trunk motion, basically the shoulder girdle and the pelvic girdle moving opposite of each other. So whether it's moving in the transverse plane in some kind of twisting or rotation, in the frontal plane with some kind of side bending or lateral flexion, or in the overused sagittal plane with this trunk flexion, and don't forget trunk extension. So I have those 3 added to the hip hinge, which makes 4 plus this. So there's 9 basic movements. So this little assignment, this exercise that we have, will go through these 9 movements, and this really forms the foundation for everything you're going to do from here on out in this functional anatomy. Looking at specifically the joints, right? Like, so instead of just looking at trunk flexion for a sit-up, look at the cervical spine, thoracic spine, how the pelvis is stabilized. Well, it'll become more complex, but this is the foundation. So hopefully that makes it a little easier to wrap your brain around it. So you're not really, if you get these 3 basic things, or like the 9 teased out down really well, and you got the 5 to 7 joints, that's not a lot to manage, right? It becomes a lot more digestible, smaller bites than thinking hundreds of thousands of exercises, complexity in terms of movement, and all these micro adjustments that happen within the human body. So the documents here, I'm just going to switch over to my screen here so you can kind of take a look. And like I said, I have these movements here. I think there's 7. 1, 2, 3, 4, 5, 6, 7, 8, 9. I said 9, right? Oh, 10, 11. So we have your basic movements, your horizontal pulling, horizontal pushing. And now there is variety in these exercises. And what really determines the variety is your grip width, right? As simple as that. Your close grip versus wide grip, what that does is it forces your shoulders into, when you're closer, you're going to be more sagittal plane. And when you're wider, you're going to be frontal plane if it's a vertical movement, or transverse plane if it's a horizontal movement. So depending upon where you grab, that's going to bring the arms in closer, like horizontal adduction, right? This is going to be sagittal plane motion if I do a close grip overhead press or close grip press. Or if I do a wide grip pull down, that's going to bring me into the frontal plane. Or in this image here, where you're doing a wide grip press, you're going to be transverse plane movement, right? So that's the only like variation that kind of changes the plane. Outside of that, like with the leg press, you can see like a closer grip or closer stance. Leg press is going to be sagittal plane, and this can be leg press, squat, doesn't matter, deadlift. If you go wider, you're going to be getting out of the sagittal plane and going more into the transverse plane. And as I had mentioned in our last lecture that, you know, we like these 90-degree straight line, perfect angles, everything matching. That's the human brain trying to quantify and organize information. In real life, we don't exist in those perfect straight lines or perfect 90-degree angles. You most likely, right, you're not going to be fully wide grip or fully close grip. You're going to find somewhere kind of in between. Same thing with your squatting. You're not going to be legs totally straight and you're going to be exclusively in the sagittal plane, and you're not going to have your legs totally spread out and you're in the frontal plane. You're going to find somewhere about shoulder width or so, and you're going to be a little off center, if you will, from the sagittal plane. But in order to keep things easier, and we talk in terms of dominant planes, right? So mostly sagittal plane or mostly here or there. What's interesting is the muscle analysis, the muscle participation is exactly the same. So we're more interested in the functional anatomy, not so much the biomechanical analysis, but the physiological or the muscular analysis, which muscles are participating. And the biomechanics influence that, but we're not looking at biomechanics all by itself. So you have then basically all your squat taken care of, and then you have your vertical pull, and the next one should be a vertical push right here. And then you have the hip hinge here, or sometimes called the semi-stiff legged deadlift or Romanian deadlift or good morning, depending upon if the load's on the back. And then you have the 3 planar movements for the trunk and spine. So sagittal plane motion, like a crunch sit-up, lateral flexion here in the frontal plane, and transverse plane in the rotation. So go through and just kind of analyze like what joint action you're seeing here, and see then if you can start to apply this to other exercises. And what's going to happen is how this course is going to progress is right now we're just trying to get the name of the joint motion, basic plane of motion, and can you visualize and understand where that axis of rotation's at. The next unit we get into, we're going to be looking at, is this movement occurring with or against gravity? So is it going to be a concentric action or an eccentric action globally? And then the next progression, next step, is looking at a joint by joint, muscle by muscle analysis, even divisions of muscles, of who's working as an agonist, who's off as an antagonist, and then that agonist, is it working concentrically to control that, to produce that motion, isometrically to stabilize, or eccentrically to decelerate that motion? So that's where it just kind of progresses. This is the foundation, and you focus on 9 things going from there. So it should be pretty straightforward. We'll talk more about this as the weeks come on, and hopefully this helps you organize your thoughts and information a little better. So we'll see you soon. Thanks.